Let's speak to Dr. James Smith. He joins us from London. He's a lecturer on humanitarian policy at University College London. Importantly, an emergency physician who has spent months working in Gaza's hospitals during the war. James, thank you so much indeed for your time. What's the latest you're hearing from your colleagues in Gaza about its hospitals and its clinics?
Thanks, Adnan. Well, I think the first thing to emphasize is exactly what Ashraf has conveyed, which is that Jared Kushner and members of Donald Trump's illegitimate Board of Peace have lauded the period that has just passed, saying that we've seen significant improvements in the delivery of humanitarian aid into Gaza. We need to be very clear here that Israel still maintains a suffocating hold on everything and everyone that enters and leaves Gaza. The situation for the health system and all other essential sectors remains dire. You've mentioned just there that approximately 20,000 Palestinians are believed to be in need of evacuation for medical and surgical care that is now no longer available in Gaza. That's likely a significant underestimation of the true number of people that can't now get the care that they need in Gaza's hospitals. Back in December, the Ministry of Health announced that there were shortages of more than 50% of essential medicines. And of course, many other essential commodities and items are in critically short supply at the moment, which has an immediate and will have a lasting effect on all patients in Gaza.
And we have heard other medical professionals tell us, James, that when a child is maimed and needs an amputation, that's not one procedure. It could be more than a dozen procedures. It's continuing treatment that people need. So the issue is not just immediately, but what will a patient need in a few years' time? And Israel must surely understand this. International humanitarian law clearly states that both warring sides must facilitate treatment for people who have been injured during a conflict. This is an abrogation of responsibility.
Absolutely, Adnan. I mean, this is not a matter of a lack of clarity. The law is clear, our moral and political obligations are clear, and they have all been willfully ignored for the better part of 2 years and as many decades now. We have to be very clear here that genocide isn't simply committed with we have, under the pretense of a so-called ceasefire, Israel has continued to create what in legal terms is described as the conditions of life that will lead to the death of more Palestinians. They've limited the entry of humanitarian aid simply to the bare minimum that is required to sustain biological life. And even then, the deprivation of shelter, of clean water, of nutritious food, Palestinians, our friends and colleagues, are dying from the cold. I mean, that is the most stark and horrific example of this strategy. We know that Israel may now, stop short of starving Palestinians to death. We saw back in 2025 that appeared to be a threshold of sorts for a very limited expression of liberal unease. But the reality is that these conditions have been manufactured, and with each passing day, the situation gets worse. With respect to patients that have, as you mentioned, complex surgical needs, individuals who have had the most horrific injuries inflicted upon them, many surgeries needed in many cases, but also long-term rehabilitative needs, long-term social and psychological support, all of these different elements, the complex layers of a functioning healthcare system, every single aspect has been undermined.
I'm really glad you mentioned the longer-term effects, James, because clearly the immediate medical emergency is very clear. Regarding Gaza's population and its demographics, with half of the population being children, in other words, 18 or under, what does a lack of nutrition, a lack of protein do to a young body? Will the effect last for years, or can it be overcome quite quickly?
The short answer is yes, it will last for years. We know that the impact of acute malnutrition has long-term consequences. We know that the impact on the body of various forms of physiological strain and stress can have long-term effects. Of course, the psychological impact of not only surviving a genocide, but watching the world sit idly by, the kind of the dual traumatization of those things will have lifelong consequences. We're talking about long-term needs that require immediate intervention now, and serious strategies that extend far beyond what Donald Trump is putting on the table in the form of the Board of Peace at this present moment.
Dr. James Smith, thank you so much indeed for your time. It's so instructive for us and the viewers.